Hey there, friends. It's Pharmacist Michael, and today I've got a simple question for you. Have you ever had your homocysteine levels checked? If not, you might be missing a crucial piece of the puzzle when it comes to protecting your heart, your brain, and even your longevity. High homocysteine levels don't usually cause symptoms, but they can silently increase your risk for heart disease, stroke, cognitive decline, and more. The good news? You can lower it naturally, and I'm going to show you exactly how. So let's get into this. Alright, let's start with the basics. Homocysteine is an amino acid your body makes when it breaks down another amino acid called methionine, which you get from protein-rich foods. Now, in normal amounts, homocysteine is totally fine, but if it builds up, that's when it becomes a problem. Too much homocysteine in the blood, called hyperhomocysteinemia, can damage blood vessels, increase clotting risk, and cause inflammation. That's a triple threat to your cardiovascular and brain health. Here's why it's so important to keep those levels in check. It's linked to heart attacks and strokes. It's associated with Alzheimer's disease and cognitive decline. It's even connected to osteoporosis, migraines, and infertility. Most labs consider normal to be under 15 micromoles per liter, but for optimal health, I like to see it under 10 or even under 8, especially if you're at risk for heart or brain issues. Now, here's the part you came for: how to naturally lower homocysteine levels. And it all comes down to supporting your body's methylation pathways. First, get enough folate, vitamin B9. Folate is the MVP here. It helps convert homocysteine into methionine, keeping levels in check. Choose the active form, methylfolate 5-MTHF, especially if you have the MTHFR gene mutation, which affects folate metabolism. Foods rich in folate are leafy greens like spinach and kale, asparagus, lentils, and avocados. Number 2, add vitamin B6. B6 helps convert homocysteine into cysteine, another beneficial amino acid. You'll find B6 in chickpeas, bananas, potatoes, and poultry. Or in a supplement as pyridoxal 5-phosphate, or P5P, which is the activated form. Number 3, don't forget B12. B12 is another key methylation nutrient. Without enough B12, homocysteine levels can rise, especially in vegans and older adults. Look for the methylcobalamin or adenosylcobalamin forms. They're more bioavailable. And be sure to test your levels if you've been feeling tired, foggy, or tingly in your hands or feet. Number 4, trimethylglycine, TMG or betaine. Now this one's a game changer. TMG donates methyl groups directly to help neutralize homocysteine. Studies show it can significantly reduce levels when used alongside B vitamins. You'll find it in beets, spinach, quinoa, or as a supplement, often paired with folate and B12 for a synergistic effect. Number 5, limit methionine. Sometimes. If you're dealing with high homocysteine and a sluggish methylation cycle, it might help to temporarily reduce intake of methionine-rich foods like red meat, dairy, and eggs, just until levels come down. Then bring them back in moderately while supporting your B vitamin intake. Number 6 is lifestyle tips that help too. Exercise regularly. It enhances circulation and detox pathways. Prioritize sleep. Poor sleep increases inflammation. Limit alcohol. It depletes B vitamins. And finally, reduce stress. Cortisol affects methylation and B vitamin metabolism. Now, here's what I usually recommend when someone wants to lower their homocysteine naturally. Option 1 is the diet-first approach. Eat more leafy greens, legumes, beets, and healthy proteins. Cut back on alcohol, sugar, and processed foods. Add stress-reducing habits like deep breathing or walking outdoors. Option 2 is a supplement stack. Methylfolate, 400 to 800 micrograms. B12 is methylcobalamin, 1,000 micrograms. B6 is P5P, 20 to 50 milligrams. And TMG, betaine anhydrous, 500 to 1,000 milligrams. Always talk to your healthcare provider before starting supplements, especially if you're on medications like methotrexate or seizure drugs, which affect folate metabolism. Not sure if you should test your homocysteine? You should consider it if you have a family history of heart disease or stroke, memory issues or brain fog, depression, especially if it's treatment resistant, autoimmune or methylation disorders, or if you're planning a pregnancy or dealing with infertility. Ask your doctor for a simple blood test. It's inexpensive and often overlooked. Homocysteine may be hiding in plain sight, but with the right nutrients and lifestyle habits, you can take control. It's just one more way to protect your heart, your brain, and your future, naturally. Have you ever tested your homocysteine? Or are you taking any of the nutrients we talked about today? Drop a comment below. I'd love to hear your experience. And don't forget to like, share, and subscribe for more tips on living a happy, healthy life. Until next time, be happy and be healthy. I'm Pharmacist Michael, and I'll see you in the next video.